Abandonment can be, we talked about that, emotional neglect when raised by nannies or relatives. Can that trigger an abandonment trauma?
It doesn't really matter what the background is. It's more to be really respectful and to understand what this person is about. It's really important to take the time to understand this person and before you start to treat them.
Hi, I'm Jan. I'm the founder and manager of Paracelsus Recovery. And I'm sitting here with Thilo Beck, our lead psychiatrist, since the very first day, 10 years ago now. We've been working together. Thilo, you've been working with us all this time with a variety of clients. What's particular about Paracelsus Recovery is that our clientele is normally from a wealthy, ultra-high net worth background, often or sometimes also with a background of public exposure, celebrities, and so on. And let's call it your other jobs. The work you do is at a non-profit organization where you're also a lead psychiatrist working with people from the other side of the socioeconomic spectrum. I think we both found that quite intriguing from the very beginning, from our initial conversations back then. And I would like to talk to you a bit today about culturally competent care for particularly the demographic we work with at Paracelsus Recovery. But let me start off with asking you, when you compare your work here and at Arut, the non-profit organization, do you see commonalities in the clientels, the struggles, the therapeutic approaches at work?
That's a very interesting question. I think what I've learned is that on both ends we have to deal with a stigmatized population, with people who have stigma. Wealthy people are isolated in our society in a way, and they don't have in certain aspects, they don't have the same possibilities as regular people have, so to speak. We often have to deal with emotionally deprived people who never had the chance to grow up as we would say a normal person would, and don't are very hesitant to have social contact with other people because you never know whether people really like you because of the person you are, or whether they are just with you because you have the money, right? And so it's from different angles, but we have to deal with people in difficult situations, and it's not as easy to be wealthy. That's what I have learned, and it can cause a lot of harm.
So what I read between the lines there is, so there's an aspect of loneliness and trust issues that are maybe more present in the wealthy demographic than in the overall population.
Very much so, and it's not only about social isolation, it's also when we look at the medical care, what these people have, and what we often see is that they are badly treated, and that they medically, because they don't dare to go to a regular hospital for treatment or to regular doctors, they end up with some treatments that are not coordinated and on and off. And so we often see very badly organized treatments or insufficient treatments.
But the keyword comes to mind, or key phrase, doctor shopping, right? That we see sometimes with a very wealthy clientele, because they have the possibility to access expertise from all over the world. But sometimes when they don't like the experience or don't like what they hear, that they can just move on to another doctor and maybe get another opinion altogether, Also, second opinions is an economic matter. Right? Most people don't get second or third opinions when they get a diagnosis. But a wealthy clientele often does, again, because of the trust issues as well. And then they get very confusing messages.
And treatments are not ended, and treatments are started and then interrupted, or a doctor is changed. So we really often see people who are badly medicated and or hardly medicated, and where we have to start from the scratch.
Where sometimes conditions are already chronified to a degree where they shouldn't be.
Yes, you wouldn't think that it would be that way. Right?
What other factors do you feel, specifically do you see, so we talked about loneliness, trust issues to some degree, emotional deprivation, that you see as a commonality between people on both sides of the socioeconomic spectrum. Let's talk about the emotional deprivation. What is that? What are the implications, and why is that specifically happening in a wealthy clientele where as an outsider you wouldn't expect that?
I think I see that on two levels. One level is so to speak, the founder generations who built wealth and often end up in an isolated situation afterwards because they are on the top of the pyramid and have trust issues there. And the other problem is then the following generations, the children of these founders or the second generation who grow up in difficult situations, frequently being left on their own, parents traveling, and they grow up with nannies managing their everything, and just never get the emotional support or the care, the emotional care they would deserve as children.
Mm-hmm. And that are important for healthy psychological development. Do we have any tips, all things equal? Imagine somebody who, let's say two parents, very busy running the family business, political and social duties or engagements. And often they want the very best for their children. So they hire, tutors, they hire nannies. Elite boarding schools are often a topic. What would be the advice to somebody, to parents like that? Because often it's not an option to just say, okay, now we have children and we need to drop our duties because it's a massive responsibility. Often we have clients, have hundreds of thousands of employees, and there's an impact if they don't show up to work. So is there what would you say to them?
That's what we have learned over time, having these family weekends where we usually invite family members to join in and to think about what could be changed for the family system. And I think it's about starting a dialogue and starting to to meet each other again, and not just to live in some ways on different paths, and to really choose to be a family and to have time together, and some people call this quality time, but just
that actually just came to mind. Could you say that actually there, like with many things in life, quality is more important than quantity? So even if let's say one or both parents travel frequently to different places in the world and don't have that much time to spend at home, but the time they do have, they should really be devoted, dedicated to the children, to spend quality time, attention, and so on.
And often it has to be practiced how to do these conversations then, how to talk to each other, and how to get this quality time together, and how to dialogue in a constructive way. And sounds trivial, but it's not at all. And there is much to be done, I think.
Especially when a certain dynamic has been in the making for many years, right? Living parallel lives or not feeling seen by each other, by the parents, by the partner. So people feel unhappy, they feel something's missing, but then it always takes well, at least two or the whole family to actually say, okay, we need to change something. We're ready to take the time, the emotional investment, and also in a way being vulnerable, right? Because often, especially when you run an international corporation or a whole political office, your everyday role is actually to kind of carry a bit of a shield around you, not to appear vulnerable. And maybe it's hard to take that off when you come home.
And to create a space where you really interact with each other and where you listen to each other and respect each other. Very precious time, actually, and but that has to be practiced.
Maybe let's talk a moment about affluent neglect, a term that sometimes pops up. I don't think it has a clear definition. But again, something that's interesting to compare, because there is neglect that is more common on both sides, again, of the socioeconomic spectrum. There's some commonalities. Neglect in a low income family or household, or single parenting, struggling to pay the bills, is in a way more intuitively graspable. But what about affluent neglect? Neglect in a wealthy family, wealthy household. What are the parameters? So we talked about lack of time and attention. What other factors can play a role in?
I think it's a lot about lack of structure as well. So everything is possible, and you would not have to do anything actually if you don't want to. And so we often see these people feeling lost and just not knowing what to do with their lives, because they don't have the direction and don't know for what values they should invest themselves, and because it's all left open in a way, and that's where we often work at to get sort of that direction into the life of these people.
And I think what you're talking about is particularly for the next generations, kind of growing up in a significant wealth. Sometimes there's a trust fund. Sometimes there's, not a clear, you don't have to work. And I think it's very natural for kids or teenagers, if they don't have to adhere to a structure, well, they don't. So you can get lost in that. And we know that how structure is, the importance of structure for mental health. Particularly mental health recovery.
To find your own values, to find what you want to live for, and not to. I think there's a lot of pressure often from the parents, from the fathers, whoever is in charge in the family, and the second generation, they ask themselves, well, I don't want to become a copy of my parents. I want to go my own way, but what way would that be?
I think we have a few interesting topics that we just scratch the surface on. So one is lack of structure, often because of economic possibilities, not the necessity, but then getting lost and not really having a purpose. Basically summarizing, having a reason to get out of bed in the morning, right? And then looking forward to the day. Purpose, we know, is super important. And then you have possibly the opposite, and we see that too, is kind of the limiting factor. So the expectation or pressures from the previous generation, from the parents, kind of limiting factors with regards to the expectation that you follow in the footsteps, that you take over the helm of the family company at some point. So what should you study? Maybe you want to study art, but actually the parents want you to study economics or law. But also with regard to who you are approved to entangle with as friends or romantic partners. So on one side, we have this lack of structure and kind of too much freedom. And on the other side, we have this stringent limitations that often are not experienced as much by the average.
Or overwhelming expectations from the first generation, from the parents, to what these children should do or what they should be able to do.
Very scary, right?
Yeah, absolutely paralyzing sometimes, and also then creating resistance and
as a coping mechanism.
Yes, and trying and saying no, this is not possible. I can't do that, or I don't want that.
So Let's talk about that a little bit. So, because I'd always imagine when you grew up basically in the shadow of the achievements of your parents, and it's probably not always only in family business, but let's say you're the son or daughter of a world leader, head of state, or a successful, famous entertainer. You will always be the son or daughter of so and so, and it takes more. It's more difficult to kind of feel like you're a person in your own right, and especially when then everybody says, "Oh, your father is so and so, or your mother, and all these achievements are praised." What does that do to your self-esteem as a kid, as a teenager?
I think that it's difficult under these circumstances to develop sort of a feeling of self-worth in a way. So what's my strengths? What I'm good for? What am I as a person, and who am I? And so that's what we often do here, also with these second generation, the children, trying to give them a new direction, trying to give them a new understanding what they could do in their lives. We work a lot with career counselors and trying to support them to find their own path, which is not that easy, really.
And then also, developing that is one thing, but then going back, there's still a part of a group, and often is kind of family dynasty, friends, advisors, family members, and so on. It must be really tough to kind of break through that from a self-esteem.
It definitely feels overwhelming and difficult to break free of and to dare to go your own way, and that can be scary.
So that overwhelming feeling. Let's talk a bit about how we see members of such families, how we see them coping in maybe not so healthy ways. That eventually leads them down, the path of seeking treatment or therapy. How do you deal with that when you're 10, 15 years old or coming of age, and you're always the son or daughter of?
I think first of all, you feel the pressure. So to be as good or even better than the person you're compared with. And that creates a lot of pressure, and not to fail and to be perfect, right? And I think then the question is, how do people deal with pressure? And there's different ways to cope with that.
Is that possibly a reason why, all things equal, we see more substance abuse issues in at both ends of the socioeconomic spectrum versus the general population? Is that
definitely? I think substance use is a coping strategy, right? To either to feel better or to deal with overwhelming stress or other uncomfortable feelings or emotions or thoughts, and so we see that on both ends, for sure.
Let's maybe jump a bit back and forward. But one particular thing I'd be interested in, and I've been asked a lot, is in many of these international, wealthy families, schooling is a big topic. Often with the best intentions, the parents want the kids to have a better education than they were able to enjoy themselves. And there's an offering of elite, academically, quite reputational boarding schools around the world. But what does it do? Again, all things equal, the different characters, but what are the risk factors? Let's say it that way. When a kid goes to a boarding school, and what difference does the age make? Because there used to be early boarding, which is now more and more not so popular anymore, I think. But still, it's what does it do to a 12-year-old, 14-year-old to be away from home?
I wouldn't generalize that because that's a very individual thing. I've seen kids who really thrived and who benefited from this sort of additional input or and grew grew with it, and others who really suffered and got lost and didn't find their way there and just suffered.
So there's no one size fits all when it comes to boarding. So it really
definitely not. I think it's important to see how your child fares with it and whether they get along with this in this system. And so really, some of them enjoy it and benefit from it.
I reckon it can also be nice to step out a bit of certain family dynamics or a certain, exposed environment, into a bit your own world where you can actually develop your independent character.
It can be enriched environment with important new inputs and learning fields. So I really wouldn't generalize that.
But would you agree then that that it's important to maybe have a bit of a pre-assessment in a way to see if a kid could be particularly vulnerable to boarding school, and to particularly pay attention the first weeks or months how somebody is faring, to filter out somebody who would really possibly get damaged.
It's good to check in regularly and to see how the kids are doing, and it's about how they feel at boarding school. But then again, what's also important is that they have the feeling that they can come back to a healthy family environment. So
to avoid an experience of abandonment, I think that's crucial, right? I once heard about a concept called boarding school syndrome when I attended a lecture on mental health of boarding school kids, and the notion was a combination of abandonment trauma and imprisonment trauma, kind of limiting freedom, because some of these boarding schools can be quite structured.
How good is the school, and what's the family sort of providing? I think if children know there's a family back home where I'm looking forward to come back to, and that is waiting for me, and
looking forward to me coming back.
Big difference, right? And that helps a lot.
And not feel like, kind of pushed away to a school, go away, you're kind of uncomfortable or you're a nuisance. And we're actually happy for you to be away. That can trigger an abandonment issues that can sometimes go through a lifetime as an adult.
Absolutely.
So abandonment can be, we talked about that, emotional neglect when raised by nannies or relatives. Can that trigger an abandonment trauma?
Absolutely. Children who grow up in a family where they feel isolated and left alone, that is severe trauma. I think that's sort of prolonged trauma, chronic trauma, and that's what we afterwards see as complex trauma.
Mm-hmm. With all the implications it has, right, on various mood disorders, self-medication, and so on, that we then clinically, therapeutically try to untangle, but it can often kind of be traced back to early childhood or generally to growing up experiences.
In such difficult circumstances and challenging circumstances where children are not seen and heard by the family and grow up on their own, right? And
when we talk about mental health and wealth, the intersection or the implications of significant wealth on mental health, there's a few other notions that we seem to come across regularly and people ask about. One of them is boredom. We talked about that a bit in a sense of lack of structure, but boredom maybe on a more meta level, what does significant wealth do? So if you can basically fulfill most of material wishes without having to, save for it, without feeling possibly guilty if you spend money on something and then, you just leave it on the side, you don't enjoy it. That can lead to significant boredom. It's like, what do I do with my life? What brings me pleasure is I guess a different question when you have a lot of time on your hands and a lot of buying power.
Well, I think that's very similar with what you experience when you use substances. It's just stimulation without much of a purpose or it's not. You wouldn't get any result that would be of purpose of that, and that's frustrating, right? So it's just passing time and not really satisfying. And it's frustrating, and so you have to do more and more and more, but you wouldn't feel really good about it, and that's what we often see. That's not the way people want to live, actually. We all, human beings, have the need to have a purpose, I think. And that's underestimated, I think.
I think it's ironic because in a way the entertainment world, the media world, it's kind of it's idealized, just to have a life of leisure. You can jet around the world, you can shop whatever you like, you can attend parties and do anything at your whim, and you don't have responsibility to show up for work. In a way, that seems to be idealized ever since at least movies, exist, and now with social media and so on. And in a way, it's ironic because it seems to me that a lot of people who then, get into that lifestyle or are born into that lifestyle with a lot of possibilities, they don't know. Nobody tells them, nobody teaches them how important purpose, structure, and also work is, and also adversity and hardship and stressful times, as we all experience when at some point we have to get a job to pay our bills, we have to pass exams at school and so on. That all forms us in a way, and when we see through a difficult period or event, then we feel fulfilled, we feel a sense of achievement. But it seems to be, is it human nature, or is it more kind of conditioning because of these movies and social media and so on, that if we're not told and we have the possibilities, we tend to just let things go because it brings us pleasure? What does it have to do with it?
I think somehow it's an illusion we always carry with us, the thinking that paradise would be to be happy all the time and to have all needs fulfilled. But I think if you think about this is terribly boring. If it's always like perfect and you're always happy, what is life about then? We need to have this fluctuating moods, and that we need to have times where we feel better and others where we suffer maybe or go through hardship, and that's part of life. And life can't be just happen on the happy side. Mm-hmm. That would be terrible, I think. Mm-hmm.
But intuitively, and I guess it comes a bit with life experience to be able to make that statement and feel it. Because intuitively, naturally, I think, and again, especially for younger people, that seeking of happiness and often confusion of happiness and pleasure and avoiding pain and discomfort seems to be kind of an intuitive way to go.
Well, I think it's more avoiding the core or the essence of life, and trying to lead a life that doesn't come with challenges, and but then people, I think, realize quite quickly that there's something missing. we need to have challenges, and we need to have the opportunity to grow and to practice, to learn. And that only comes when we also challenge ourselves. And
possibly in a way, ironically, it's because when somebody has a material privilege to seek such a lifestyle, the problems come automatically, right? And that's why we see clients coming through our door, often from the outside or the out group, or people who are not living with that significant wealth. There's often a misconception that money buys happiness, and if you can afford everything, that's absolutely wonderful. When it is,
money is not the answer, and money is not the solution. It can be a problem on that way, I think.
Let's talk about culturally competent care, or how, as clinicians, yourself as a psychiatrist, here we work with teams of psychologists, counselors, various people who help a client, a patient heal. In how far the specific experience, modalities, mindset of the clinician matter in order to be able to really provide the best possible care for that demographic. Question short, can any trained clinician equally provide the best possible care for anybody from anywhere on the socioeconomic spectrum, or do we need specific know-how or approaches, insights, experience with a wealthy clientele?
I think experience helps to know the environments that these people live in, and to understand the challenges and the problems that might come up with it, to know what they are talking about and where they're coming from. That helps. But I think most important is to be open and to be open and to understand what client we have to work with here, and whether this is from the super wealthy spectrum or from the other side. I don't think that makes much of a difference. It's about understanding the individual you're working with at the moment, and only intervene then when you really know what this person is about, and to have a bond with this person, and to know together what you want to work on. And I think for this process, it doesn't really matter what the background is. It's more to be really respectful and to be truly interested and to understand what this person is about. Sounds trivial, but I think in psychotherapy, often therapists treat sort of have this one-size-fits-all approach, that they think, I have a method and I work with this method, and the client has to fit into the method in a way. And that's what we have learned here. We really try to design the treatment for every individual client anew, and sort of use different methods, different parts from various methods, put them together, and according to the needs of the individual client. So it's really important to take the time to understand this person, and before you start to treat them.
To understand not just their psyche, but also their reality, their understanding of reality, which includes dynamics in the family, their environment, their view of themselves.
Right. To get the whole picture, and only then you can plan interventions or come up with suggestions for therapy.
We started out by you saying that it's a stigmatized population in a way. So stigma often comes with shame, and do we see with a wealthy clientele, is that a particular issue, or is it with like with everybody else? And I'm asking particularly because for some exposed individuals or families, can have reputational consequences if they or a family member struggles emotionally, or more significant consequences than you might have from somebody on the other side of the socioeconomic spectrum.
I think the stigma is more the pressure you feel to fulfill a role. You might doubt yourself whether you might be fit to live, and knowing that people think that you must be happy and perfect, and that's a lot of pressure, and behind all of that, asking yourself, well, can I really do that? And I think the stigma is the expectation to be on the top, right? And to be the best, and to have no problems.
Mm-hmm. Mm-hmm. So when you perceive this as an affected person, and you feel not up to it, that can create a significant gap, dissonance,
a lot of pressure and suffering and hardship.
When working therapeutically or engaging therapeutically with a client who knows that you're a psychiatrist, we're clinicians, and they know what they've achieved and how we might perceive them. The therapeutic dynamic, the trust that has to be built, is that different? Is it more challenging, or is it similar to providing therapy or engaging in a therapeutic process with somebody from a different socioeconomic group?
I think in many ways it's very similar. It's the same process to open up to somebody and to have enough trust to open up. So you have to build that trust first, and take the time to do that. And that's what we do here. We really take as much time as it takes to get to that point before we start doing therapy, as I said before. And so I think that's a general principle in psychotherapy. That
so for a patient to feel heard and seen and respected for their reality and
give every single client we have here the space and the time to express themselves and to share with us, and then to develop hypotheses and theories what should be done.
Mm-hmm. You mentioned time a lot. It seems that time for productive therapeutic process is in a way of the essence. And time is time is money is something we often hear. It's in the public health sector particularly. There's a certain amount of capacity of therapists, and also what insurances or the state pays for. Do you feel that there's that's an issue, that when you have one session a week or one session every 2 weeks, 45 minutes, does it just take longer to get to that spot, or is it even impossible to get to a certain point therapeutically compared to when you have several therapeutic interactions a week?
Well, my feeling, what I've experienced in this setting here, that we see amazing progress with this intensive approach, where we work as a coordinated team on different levels in the same direction, and that we see effects we wouldn't see in a regular treatment setting, not as quickly, and maybe some of them not at all. Because I think we can reach the client on all these different levels, and they all interact, and so that results in a much more much greater effect in the end.
So working as a team, also different individuals have a bit different approach, different insight, maybe different accessibility to client-specific issues, and then complementing that, coordinating that together.
It all adds up
faster.
Yeah, it all adds up, and so we get much amazing. You see amazing effects out of this coordinated approach, and it all adds up one to the other, and so the one and one results in more than two more.
Is that experience to work in this environment approach as a clinician? Is that very different for you than when you work one-on-one in therapeutically with a client? Is like, how do you compare the experience? It's just,
I think it's much a broader view we can take on the client, and because all the people working here in the team, they have their own expertise, and they have different angles, and when we share this all together, we get much better understanding of the client, and we can intervene in a much more better informed way, and so we have results we wouldn't get otherwise. That's really amazing to see.
And it seems to me, and I'm interested in your thoughts there as well, is in between therapeutic sessions in this intensive treatment program, there is other treatment modalities that help to integrate, to reflect, also to relax. It's kind of all carefully choreographed. For somebody who doesn't have access to a intense treatment environment or coordinated treatment environment like that, do you feel that there's something that could be done easily for people to benefit more in psychotherapy? Let's say if one session today, if another session in 1 week or 2 weeks, like the in-betweens, the integration, the carrying forward of what comes out of the therapeutic session when you just walk out of the psychiatrist's office, you're on your own again.
I think that's what we do regular. I will call it regular psychotherapy. We try to give homework to sort of things to practice or to think about between sessions. But still, it's a much more intense setting we can create here, where we stimulate the client constantly, and also give enough time to process. But it's really individually adapted, and to get the best result.
It's I just imagine if somebody engages in psychotherapy or seeks psychotherapy, they're not in a good place, at least initially. And when then on your own and you get homework and you should practice, but you feel really down and don't have the energy, it's much harder than if you have somebody who just kind of tries to motivate you, or you have a structured program,
or a setting that holds. And I think that's what we see here, and the feedback we get from the clients, that they really feel at home, and it's like being in a family, and they feel cared for, and that creates the environment where people can learn and grow. So I think that's a very important aspect, to give our clients this feeling to be in a safe place and to be cared for.
Especially in those first weeks of any treatment, that can be quite painful and tiresome. So feeling left alone in between therapeutic sessions can be quite tough.
Yeah, absolutely. And so that's really one of the key points, I think, of this treatment approach, that we use every single moment to support the client on his or her journey, and are able to adapt the treatment and use every single second for this purpose.
Maybe last but not least, let's talk about the importance of family and let's say peer network, but particularly family. When somebody goes to a treatment, to a clinic, such as here at Paracelsus Recovery, they leave their home environment. They engage in quite an intense journey, often very transformational, and the family stays at home. Maybe they communicate, but they don't really embark on the same journey. Can that? What are the risks? For when a client goes back home, how do we best mitigate that possible gap, and what can be done if family members are not really willing to engage, which we sometimes see as well.
I think one way how we deal with it is with these family weekends, that we invite family members in and share the work that has been done and the progress that has been done, and anticipate together and look forward and think, what can every single family member do to support the client, and also to grow as a family, and to give them a new direction here as well. And I think that's really important and must be considered. That's why we also offer aftercare to sort of support this process after end of the program, to send somebody home with the client to help to...
Yeah, that integration can be almost as important as the treatment experience itself, right?
Otherwise, the progress might be challenged, or and frustrating, because it's not supported back home, right?
So that support from back home. So part of it probably comes from not understanding what's going on, or the journey a family member has been on, and we can mitigate that by involving them with educational work, with family therapy, and so on. But sometimes we also see clients who come from a more dysfunctional family, where a lot of the family dynamics and problems are projected onto one individual, and it's difficult to engage the family on a, let's say, productive level for that patient's return home. What do we do then when we realize that there's only so far we can get with the family?
First of all, we try to get the family on board and to make it their mutual journey. And if this doesn't work, then I think we have to strategize with the client how they can go on their own journey and have their own life, and care for themselves, and without the support of the family in that way, and how to draw boundaries as well, and to protect themselves, so to speak.
That's we're running out of time soon, but you mentioned boundaries. So one thing I would like to touch upon: how do you hold boundaries if your father is, this uber successful, powerful, sometimes very dominant figure, and you financially depend on them, your family name, your reputation, everything is kind of dependent or entangled with the patriarch. That's something we sometimes see. What do we advise to somebody with regard to boundaries?
I think there's not much you can advise in that way. It's about growing into another role, and that takes time as well. And to learn that you yourself are a valuable person, and to develop self-compassion and to be proud of yourself as the person you are, and totally realizing that you will never be the same success as your father might be, but still be proud of yourself.
Or maybe realizing that success is relative, right? It doesn't necessarily make you happier or better person if you achieve the same material or career success, but that it's very individual, and to find that your own purpose
and to be proud of that, and to say, well, I might be not the same. I might not go the same way as my father or my mother did, but my way is still valuable.
It's not less valuable.
No.
Yeah, I think that's very important. Yeah. Self-compassion, self-respect, which also translates into self-esteem. And then, based on that, one can nurture purpose very much. Well, thank you, Thilo. That was a very interesting exchange.
Okay, thank you for having me. And it was interesting to discuss.